as it has been 1 year to Bio E3 Fuel, today we are joined by MD of BIRAC, Dr. Jitendra Kumar. Sir, my first question would be, as we have target of 165 billion dollars in 2024, and we have target of 300 billion dollars in 2030. What measurable development do you see in India as biomanufacturing?
Yeah, I think you have rightly said we now stand at 165 billion US dollars by economy, and we aim for 300 billion US dollars. And I think for last couple of last decade has been a transforming for our bioeconomy, because I can give you some figures to give an idea. For example, in 2014, the bioeconomy was around 20-30 million US dollars only, million. But now if you see after 12 years, it stands around 165 billion US dollars. The cumulative growth has been huge. And I think this has been achieved by various measures which BIRAC has taken. One is that it has increased the appetite of these entrepreneurs in biotechnology. For example, this biotechnology entrepreneurship is very capital intensive. A lot of infrastructure is needed. We have a lot of fundings requirement. We have a high gestation period. But therefore, a lot of startups were not coming into this field. For example, there were only few hundred startups in 2014, say maybe below 500. But now it is 10,000 startups in 2024. Now the figure has increased more, but I am just quoting 2024 figure, which was around 10,000 startups. It's not a mean number, it's a mean achievement, because the number of startups are directly related to the kind of economic hope that they are seeing in this field. That's why the number is increasing. Now why this number has increased is BIRAC has created so many programs in this field, biotechnology field, and actually broad areas of life sciences. For instance, we have created incubation centers. Incubation centers are nothing but the plug and play facilities, laboratory facilities, where an innovator can go and use that facility and do proof of concept studies, do research and innovation in that, and try to see that the product is launched in the market. So right now we have around 100 BioNest incubation centers. Every year we have funded 10, 15. Now it is more close to 100 bio-incubation centers. And these bio-incubation centers provide all kind of support. This is not only plug and play laboratory facility, but mentorship, funding, networking, branding, all these facilities that are required for these startup companies to actually take their innovation forward. So that is one. Because Indian ecosystem, many academic research labs and central universities, IITs did not have the incubation center. BIRAC felt the need in 2012, starting with 2012, it felt the need that there is an incubation center requirement in each of these academic institutions, and we created this. The second was, even if we created incubation centers, we did not have a good funding to support these startups. So in 2012, again, we started Biotech Ignition Grant and other battery of grants or funding support programs such as SIBRI, BIPP, product commercialization scheme, etc. at every level. So they did not have any gap. One after the other they used to get the funding, and last was product commercialization grant, where they used to have some money for commercialization. However, these money still was less for taking to the scale. For example, if I say product commercialization would grant would be around 5 to 7 crore. For a Biotech Ignition Grant, initial level of ideation, it was like 50 lakhs only. Then next level of grant would be around 5 crore, something like that. This coupled with incubation center, they could have managed some level of entrepreneurial growth and sustainability. However, the real growth was not happening because there was a valley of death after that. They were not able to actually scale their innovations. Scaling has various connotations. One is that they did not have facilities for it. For example, they did not have CGMP facility, they did not have pilot scale facility, they did not have clean rooms, etc., where they could manufacture their products. So at the scale, manufacturing at scale was not available. So BioE3 policy has envisaged that we have biofoundries and biomanufacturing hubs across the country, where these startups can actually go and use that facility to scale up and manufacture. It's not only about biomanufacturing, it's also about the time it takes for innovation to go to the market. For example, these biofoundries would have DBTL concept, design, build, test and learn, where their high throughput process flows, computational biology or computers and scale-up facilities, where a person can actually design and test very fast their concepts. If suppose if they have to clone a gene, and test whether it is, a desired molecule is being produced, they can first design at the computational level, bioinformatics level within this thing, and then they can high throughput, they can actually design many such constructs and clones, whether this whole pathway has been correctly cloned or not, and then test it very fast through high throughput again. So process flow, high throughput, etc. And then of course biomanufacturing. So all these facilities are available at one place, was not earlier available to them. So the growth was inhibited. Now these startup companies can actually go to the market very fast. This is what is envisaged by biofoundries and biomanufacturing hubs.
So if we talk about BIRAC supporting startups, how much investment we have already, launched 21 biofoundries. How much investment BIRAC is supporting these startups, and how much more startups we are expecting?
So 21 biofoundries actually have been created with support of around 400 crores, but we have around pool of 1500 crore. We will be able to spend within a year or so. We have second call already is launched. So it's a milestone based payment. So they have to first do one milestone, then we'll pay, etc. and all that. So all the money we do not give all at a time. However, the total funds that BIRAC has been given by DBT is around 1000 crore. But again, I think more and more funds can come if there are more proposals of this nature. We think that biofoundries are a very crucial link for the biomanufacturing and bioeconomy, and therefore setting these up in the entire country, many places, is very, very important for these startups to grow.
So when we are expecting these grantees to be operational in the upcoming, when labs are being built?
So some of them are already functional with their own money, because they have not stopped the project. They have already, they were working and they got the government grant and support, government funding support. So, but I think within 6 months to 1 year, they will be able to launch this facility for public use. For biomanufacturing hub, they can do their own molecules also. Their own molecule they have to do, actually speaking. So they will be utilizing that facility for production of their own innovation and product. However, some of the vacant time or the idle time, you can say, of the facility, they can give it to startup companies also. And so it's a national facility. Biofoundries, of course, they may not have their own product, but they may have lot of startups or companies who will be actually coming into this and actually using this facility to develop their product and biomanufacture there.
Are we in partnership with Angel One, World Bank, and more companies?
Yeah. We have lot of partnership with the world agencies. For example, World Bank, we have lot of partnership called, with them, partnership with World Bank is, we have developed a project called National Biopharma Mission. And then second is our Bill Gates Foundation. We have funded, now it's called Grand Challenges India. And then, we have funded in the past with, we have collaborated in the past with WHO and other agencies, global agencies also. So we are very well versed in the global, funding mechanisms, how to actually use the fund and how to actually deploy these funds. I think going forward, more and more international collaboration will be achieved through these forward-looking policies and progressive policies that we are launching.
So where do you see India in biomanufacturing development, as UK, China, and other countries are already heavily investing in that?
Yes, you are 100% right. We are little bit late in the game. So, for example, I would give you some ballpark figure. Biofoundries concept was there, of course, for a decade, but actual biofoundry alliance, you can say, Global Biofoundry Alliance came into being in 2019 in Japan, and it consisted of some 40 members, 40 biofoundries across the globe. We did not have any single one that time. But now we can say that we have 21. So 40 there, so even if some may not be members, so give it, if liberally we see some may not be members, so even if globally you see, there may not be more than 50 more. So let's take a figure of 100 biofoundries across the globe. In our country, we have our progressive, with Dr. Jitendra Singh, our honorable minister, we have taken this initiative of creating such biofoundries. So number is 21 out of say 100 existing is actually close to one fourth, which is very close to our bioeconomy. No, so not bio, the whole economy. So we are fifth largest, fourth largest now. We are fourth largest economy in the world. So optimally, we are taking steps, and I think the story is not here. We'll fund more and more biofoundries now. So I think India will take a lead in biomanufacturing in our country. I think this is needed because for most of the time we have been dependent upon other countries like China and other countries to actually get raw materials, etc. But now here we can manufacture our own, many of these. So slowly it will catch up. Once we can manufacture, see what it does is it lowers the entry barrier into this field, because biofoundries and biomanufacturing hubs actually, they will, now companies will not have to spend so much. So of course their investment will reduce and pricing, the cost will be less actually. So they will be more competitive globally. We envisage that some of these companies will be very, very globally competitive.
So as we talked about, we were dependent on the imports from China. One man was also talking like earlier only one company in India used to manufacture calcium gluconate, and now we have enzyme oxidation technology to produce that by our own. What biomanufacturing is into everything, healthcare and other things. What other main measures do you think we should be in?
No, we have to replace slowly the chemical manufacturing pathways because it's not environmentally sustainable. If you see Bio E3, it means biotechnology for economy, environment, and employment. So environment is a major component here. Economy definitely, but environment. So economic development has to be coupled with the environmental sustainability. How this can happen is, so far our progress has been all chemistry based, chemistry, chemicals, petrochemicals, etc. And it has created a huge pollution. The carbon footprint is huge. The environmental degradation has been huge. If we see last couple of decades, we are at the brink. A lot of environmental damage has happened. So this kind of development is not the ultimate goal of development of humankind actually. So the the biomanufacturing concept is built upon sustainability. We do develop our economy, and we do develop economically, but without damaging the environment. That is how it is inbuilt. And then employment is definitely, because employment is a very, very important aspect of economy. Unless you can get a gainful employment for our youth, the whole development will be self-defeating. So therefore this economy is a very E3 policy, very holistic policy, which talks about these important components of the economy and the sustainable growth. I think within 1 year we have achieved a lot of awareness among the startups and youths and employment industries who are willing to take up this biomanufacturing now, who are willing to take entrepreneurial journey, who are willing to test their new ideas in this biofoundries. So I think this is a huge impact, and within 6 months to 1 year you will see a lot of these biofoundries operational and functional, and lot of these being used for developing innovative new products. I think within next 5 years, we are talking about 2030, I think India would be poised for great strides in bioeconomy. I can tell you this. So I think we will surpass the 300 billion by US. Of course, this is our goal, but we will surpass it. I'm 100% sure. The way it's growing, we'll surpass it.
So the third E, employment we have in Bio E3, what is the scale or number we have in job creation and what sort of jobs like bioinformaticians or bioengineers, lab technicians, what sort of job we are?
All sorts of job, all sorts of job. right from bioinformatician, because that's a design, I said, no, DBLT, design, build you need bio, microbiologists, biotechnologists, etc. Then you need, of course, lab technician, as you said, right from that to scientists and process engineers, because now we are talking about fusion of two fields, engineering and biology. So you need engineers and biologists to actually onboard it, and a special set of people who understand both. So basically, slowly it will come that person has to understand the concept from both engineering as well as biology side. However, therefore, we see lot of employment generation in this field. We also will see that because economy will grow, see lot of entrepreneurs will be there in our country. So these entrepreneurs will be actually hiring people. I have seen in my past stint at Bangalore Bioinnovation Center, within 1 year, these startups are able to hire 3, 4 people, and it grows exponentially, and they need bigger space. So within 3, 4 years, I have seen people growing to 25, 30 employees, and more than that. I'm just telling you average. They get a lot of grants from support, and then incubation support, and they can attract a lot of venture capital, and that's how they can employ a lot of people. So this is definitely employment generation. So if within 2, 3 years or 4 years, if numbers can increase so exponentially, you talk about 10,000 startups now in our country. So you see the cumulative growth of employment, and now these numbers will grow to exponential level. So there will be going to be a huge impact on the employment, I can tell you. So right from the startups to the bigger industries, to the people who use biofoundries, to the people who use biomanufacturing hubs.
So, and approximately number or scale, if we do have about the creation from
Within 1 year,
yeah.
within 1 year, I think within 1 year we should be able to generate around 5 to 10,000 employment. That is our guess. More than that, but I'm being conservative.
So we have also launched high performance these biomanufacturing platforms. So what are the difference between these biofoundries and biomanufacturing
Very good question. Actually, many people might have been confused. So biofoundries are places where you have this lot of facilities for testing your ideas. For example, DBLT I told, no, design, build, test and learn. So any innovator can come there and use these facilities or automated process flows and computational biology, and these are public used for public use, and public can use it, and it's mostly into public places, means mostly into academic research institutions, mostly into that. I am not saying they are not there in industries, but I am just saying for the sake of classification, mostly these are run by the public funded institutions where they can provide services to the companies, to the startup. But however, we have funded biofoundries in some companies also, incubation centers also, who are actually will provide such facility. Uh, when we talk about biomanufacturing hubs, we emphasize that the applicant himself has some molecules or some innovations which he can scale up. That's not the requirement in biofoundry. They may have certain leads from industry and startups who will be actually using this facility that they have to show, and they will actually help those. But they may not have their own molecules or own innovation. But here in biomanufacturing hub, we ensure that they have their own product or technology which they will actually manufacture and show to us that it has gone to the market. This is the basic difference. But biomanufacturing hubs may also have components of biofoundry, because ultimately we have also emphasized that they should be actually made available to the startups also for biomanufacturing.
So who are the prime stakeholders who will get benefit from it, and how it will be access to everyone, or who all has access to this platform?
So startups have access to this platform, bigger companies have access to platforms, researchers of academia will have access to these platforms. I would say this, I will categorize them into these baskets. MSMEs, of course. These are the people who will have access to these facilities.
So my last question would be, what are the challenges that we are having to achieve this target of $300 billion in 2030, and how BIRAC is looking after these startups, and can you elaborate about the RAPA thing BIRAC do have?
Yeah, so the major challenge which I see in achieving this bioeconomy is, one is we do not have a clear-cut regulatory pathway for many of these, new emerging technologies, and which is very obvious because our CDSCOs and regulators also may not understand the nature of the emerging technology. So therefore, regulatory pathways are not clear. And second bottleneck in achieving this aim of 300 billion US dollars is the flow of capital. I mean, we do not have early stage venture funding. We do not have enough venture capital in biotech. So I would say what steps we have taken to actually address these challenges. Talking about the first challenge, regulatory pathway, BIRAC has created RAPA division, which is Regulatory Affairs and Policy Advocacy, and they handhold the startups and innovators to navigate the complex pathway of regulation and liaison with CDSCO, which is a regulator, and try to see that they are actually helped properly. Helping them, filing and clarifying their doubt, because we have also empaneled some of the experts with whom we always have a conversation with the startup and with the experts so that they are helped. Second, of funding, challenge, we already have in our country, you must have heard about RDI fund from ANRF. Anusandhan National Research Foundation has created RDI, Research Development Innovation Fund, which is around 1 lakh crore. Honorable Finance Minister has already announced, and around 20,000 crore is actually coming this year, has been already allocated. So these funds, what they will do is they will help these startup companies or innovators or even bigger companies to actually take these molecules or take their innovations to the market. Because right now that funding is limited. We do not have enough venture capital in the country. So therefore, I think, and BIRAC already has created a lot of basal platform of not only infrastructure but also funding. So coupled with this, I think the funding challenge can be addressed very nicely. And a lot of venture capitalists will also come, because as you might have heard today, many of the innovators were saying when BIRAC funded their innovation, a lot of venture capitalists came to them. Then we want to fund. So there it has a multiplier effect. And therefore we are very keen, that we are very optimistic that it will have a game changer effect.